Let me bring Jeff Arnold to the stage, sir. Thank you very much. Come on up. Let's give him a round of applause.
Good morning. Thank you for having me here today. It's always a pleasure to be here, and look forward to taking about 30 minutes with you and talking to you a little bit about what we've been doing with Sharecare and HMSA. To give you a little background, about 20 years ago, my wife and I started WebMD, and it was back in 1998. And even way back then, the tagline for WebMD was, "Now health has a homepage." My wife's a nurse, and we thought that there needed to be a destination on the internet where all your information could be put there, and where doctors and patients could collaborate, and hospital systems and health plans. But what we learned back in 1998, because we didn't have the smartphone and some other things, it was difficult to get beyond just getting information. And at that time, it was the first time that people were getting content not from their doctors in large scale. So it took a little bit of time for technologies to catch up. And in 2010, we had sold a company to Discovery Channel called How Stuff Works. And I was their Global Chief Digital Strategy Officer, which I often joke was a fancy title that means nobody reports to you. And one day I got a call from the CEO, and he said, "Will you get on the phone with Oprah Winfrey and Dr. Oz and brainstorm digital health?" And got on the phone, and we started talking about digital health. And there's a website you can go to called the Wayback Machine. And I went to the Wayback Machine, and I typed in WebMD 1999. And I was looking at it, and I was looking at the current versions of digital health sites that were out there. And I thought to myself that things hadn't really changed that much. And yet there was so much opportunity, because Facebook and other social platforms have taught us so much new things about how to actually engage with people. And started thinking, what if you could have a mobile platform that was architected to connect trusted brands? And what if you could inspire digital caregiving? So instead of having a WebMD, you could start to humanize all this technology, and your doctor could become their own WebMD, and people could go beyond just getting information. So we left Discovery Channel, Don Whaley, who's our president and kind of our core team, and we kind of embarked on this vision of how could you actually get all your health in one place, and we started Sharecare. So the idea with Sharecare is there's so many apps, that are out there. There's, kind of what we call the sea of apps. And we started thinking, I don't have 12 apps on my phone to manage my money. Why would I have 12 apps on my phone to manage my health? And the same way Facebook has become my social profile and LinkedIn has become my business profile, how could Sharecare become my health profile? And is that possible? Could you take all the point solutions and all the fragmentation of healthcare, and by leveraging a smartphone, be able to bring it together all in one place on behalf of the person? So we started kind of looking outside of healthcare for inspiration. And so I'm sure all of you guys, like on New Year's, your friends are sending you emails and you're getting fired up for the new year. And I got this one interesting text from a friend of mine that was describing the landscape of disruption. And I got kind of fired up as I was reading it, because I started thinking about what we were trying to do here in Hawaii and with Sharecare, which was really to change healthcare. And is that possible? And so I took a few snippets out of this text that I wanted to put on the slides today. So the first is that software will disrupt most traditional industries in the next 5 to 10 years, including healthcare. And so we start to look at where has that already happened. So think about Uber as a great example. Uber's the biggest taxi company in the world, and they own no cars. So as a software company, they've actually now become the biggest taxi cab company in the world, and they don't have to buy one car. In the hospitality space, if you look at Airbnb, they've now become the biggest hotel company in the world, and they own no rooms, right? So these are people that are renting out their condominiums, started with people renting couches in their living room, and now they've become the largest hotel company in the world. If you look at IBM Watson, they say that now Watson can give you legal advice with 90% accuracy, where humans are 70%. Now that's still some basic law, but you can see where it's quickly going. If you look at Facebook, Facebook now has pattern recognition software that can recognize faces better than humans. I think about, I was at the Rose Bowl on January 1st, and the person in front of me taking a selfie, and I'm a couple rows back, and Facebook knows I'm in Pasadena at the Rose Bowl, and the implications of that by somebody else taking a picture of themselves. So the facial recognition software is here. And around 2020, as you start to hear about autonomous cars, they say that you will not want to own a car anymore. You will call a car with your phone. It will show up at your location and drive you to your destination. You will not need to park it. You only pay for the driven distance. You'll be able to pick the type of car that you want. With less cars becomes less parking lots. With less parking lots, maybe there's more parks. With autonomous driving, they say there'll be 1 accident per 6 million miles. So there was over 1 million people that died last year in car accidents, and it's 1 in 60,000. With autonomous cars, it goes to 1 in 6 million. And new smartphones will have 3D scanning possibilities, so you can then 3D scan your feet, and you'll be able to print your favorite shoes at home. So the price of 3D scanners, the price of 3D scanners in just the last couple years has gone from $18,000 to $400. Soon it'll be in your smartphone. And once it gets to your smartphone, they say by 2027, 10% of everything that's being produced will be 3D scanned. And I'm sure you've seen it now, like on the Space Station, that they no longer have to stock so many different tools. They can just produce it in space. The cheapest smartphones are already $10 in Africa and Asia, and by 2020, 70% of all humans will own a smartphone, and that means everyone will have the same access to world-class education. There'll be a medical device that works within your phone by 2020, which takes your retina scan, your blood sample, and you can breathe into it. It'll analyze 54 biomarkers that will identify nearly any disease. It will be cheap. So in a few years, everyone on the planet will have access to world-class medical analysis nearly for free. So the question to ask yourself as you see these stats is, do you think we'll have that in the future? And if the answer is yes, how can you make that happen sooner? And the other key takeaway is if it doesn't work with your phone, forget the idea. And any idea designed for success in the 20th century is doomed to failure in the 21st century. And so as I read these stats, the headline that I took away from that was that it's time to change healthcare. They're doing it in transportation, they're doing it in hospitality, they're doing it in education. We have access to the same technologies, the same capital. We just need to change healthcare and move it into the 21st century. So how do you do that? So the way that we believe that you go about this, and there's different strategies, but one is we think that it has to be driven around the consumer. That consumer-driven healthcare is going to be the key to that landscape of disruption. And there's kind of 6 core elements that are needed to be able to disrupt healthcare in a way that doesn't disenfranchise the provider, disenfranchise the health plan, but actually enables them. And it's going to be centered around data, it's going to be centered around technology, and it's going to be centered around scale. So let's start with data. So as we know, like the car companies, who they view now as their competitors are the Googles and the Apples and the Facebooks, because those are the companies that have access to the data. And data management is everything. So within healthcare, how do you start to get your arms around what to make investments in and how to actually change healthcare? So first you have to have your pulse on the heartbeat of America. So one of the tools that Sharecare has is we partnered with the Gallup poll, and since 2008, we make about 500 phone calls every day to zip codes all around America, trying to understand America's health. How many people are uninsured? What's the prevalence of diabetes? How happy are people? And it gives us a great baseline to start to work on what technologies that we develop to improve those numbers. If you look at Hawaii, Hawaii is a great example of a state that really thrives in well-being. For the last 6 years, Hawaii has ranked #1 in the Gallup Sharecare Wellbeing Index. And so you can see from the stats here doing incredibly well in stress and smoking and healthy eating. We see a little bit higher prevalence in diabetes here in Hawaii than we do in some of the other areas. But overall, Hawaii is becoming a model for the rest of the United States as it relates to well-being. What we try to do at Sharecare, in addition to gathering data at the population level, is we think it's really important to go from population health data to personalized data. So what we do is when people sign up for Sharecare, they take the Real Age test first. And the Real Age test is a health risk assessment that tells you what your body age is, not your calendar age. And we've had over 45 million people take the Real Age test, and we get about 200,000 new people every 30 days who take it. So it gives us a lot of good information about somebody's lifestyle and medical history to tell them how actually old their body is. But then we bring in lots of other data on that person. So the data that we like to assemble as we build kind of that health profile similar to your social profile on Facebook is we take self-reported data, we take device-driven data. So on your phone, with your permission, we look at your accelerometer, your social graph, your calendar. We take medical claims data, so we can look at your procedures, your conditions, your medications. We do data enrichment, so we bring in the social determinants of health data, and we add medical records. And then we put that onto a platform that has artificial intelligence that starts to give you a lot of insights that helps you better manage your health. But one of the key capabilities in disrupting healthcare is going from population health data, which is important because you need a baseline, but to personalized data. So the second thing we think we need in healthcare is we need a lot of collaboration. So instead of everybody kind of working in silos, how can everybody work together? So at Sharecare, over the last 5 years, we've been trying to work on a model that brings partners together to help make healthcare better. And so our philosophy has been how do we organize partners in the living room, in the exam room, and in the workplace? So in the living room, Oprah Winfrey, Dr. Oz, Sony, Discovery Channel, and Hearst have become partner of ours. And I'll show you how we use our media partners to drive awareness to consumers of what consumer-driven healthcare is. We also think it's important to connect the exam room. So we've long been big believers that the future of health will be all around connected care. So if Uber can connect a passenger and a driver, how can Sharecare connect a patient and a provider? And so a lot of our investors are big health systems. HCA, the largest one in the US, and 42 DMAs across the states, is kind of our anchor hospital partner, where we have created an innovation lab with them, and we have 50 full-time engineers that just develop products to connect patients and providers through their phones. And then most recently, we've been working on the workplace, who pays for healthcare. So HMSA has become a partner of Sharecare's. We announced this week the largest Blue Cross Blue Shield plan in the Mid-Atlantic became an investor in Sharecare. But the idea is not having these investors just investing in Sharecare in silos, but saying, how do we take the living room, how do we take the exam room, and how do we take the workplace? How do we all come together and leverage that capital so that we can make improvements in Hawaii, in Maryland, and then share in those best practices so that we can improve those Gallup Sharecare state rankings even more. We've also had to assemble a lot of partners, again, in an effort to kind of eliminate this fragmentation. So what you'll find at Sharecare is you'll find large for-profit hospital systems, large not-for-profit hospital systems, global insurance companies, domestic insurance companies, self-insured employers, and government. And I'll show you later in the presentation, how we try to activate these different partners in different ways to inspire our users. So in changing healthcare, it starts with the data, as we talked about. Second, it's all about collaboration, having enough capital to move the needle and enough partners that can work together from the living room to the exam room to the workplace. But it also takes a lot of capabilities. So this gets back to, instead of having 12 apps to manage my health, how can I truly have one experience that meets people wherever they are on their health journey? So at Sharecare, we've made 11 acquisitions, and we've spent $500 million in the last 4 years building this app. Which is a little daunting when you think that this is a $500 million app. But the importance of this is that it all needs to work together. So instead of being an aggregator of products and services, how do you actually become an integrator? And the benefit of being an integrator with technology is you're able to accomplish three things. One is you're able to have the data talk to each other, which is really important to give the user insights. Second, you're able to build a user experience that's comprehensive, and so that you don't have to go to multiple places to do things. And then lastly, you're able to make it affordable. So by putting all these capabilities in one spot and owning the assets, you're able to get it to a price point that the market can adopt. And what you do inside this health profile is what we call self-directed care, coach-directed care, and clinical interventions. So in the self-directed care, you learn what your real age is. You start to get information sent to your timeline every day that's unique to you. You start to track your steps and your activity and your sleep and your stress. And then from there, we assign a risk score to somebody, and if they need additional coaching, we employ about 750 nurses, and then through the platform, we help you with evidence-based protocols to manage your weight, to help you stop smoking, to get your diabetes under control. And then when you're not feeling well, you can go to the platform and simply talk into it and give the platform your chief complaint, like a migraine, and then we ask you questions, and then in less than 3 minutes, we tell you your likely cause. We look at your location, we check your eligibility, and we triage you. So how do you go from wellness, illness, to lifestyle in one place and be able to take healthcare from being episodic to every day? Meaning you don't just think about your health when you're sick, but you start to interact with your health every day, similar to how you might interact with your finances. So with all those capabilities, the key to this in a consumer-driven healthcare lens is how do you bring this to the person? So in the past, the way collectively as an industry we've looked at this is, how do I as a hospital get my patient to my portal? Or how do I as a health plan get my member to download an app? Or how do I as an employer get my employee to a benefits platform? And at Sharecare, what we said is we need to really look at the person holistically. The person is a consumer, the person is a patient, the person is an employee, the person is a member. And the person needs to control the permissions, the person needs to control the data. And what we need to do is build a platform that brings those stakeholders to that person. So the person doesn't have to go to all those various points, those stakeholders come to that person. And so what we do is we surround this person with all the capabilities that I was just talking about, and we realize in this kind of comprehensive approach, people will come in and out of solutions as they need it. And then inside the platform, we have these 4 M's that we're trying to achieve with the user every day. One is, how do we do intelligent messaging? One is, how do we motivate the user? Third is, how does the user or the consumer manage the data? And then how do we measure this? So starting with the intelligent messaging, the way that the platform works in this attempt to kind of disrupt how consumers interact with their health today is we build one timeline. So think of a timeline like your Facebook feed, and in that one timeline, we have authoring tools and analytics and artificial intelligence that we can extend to the stakeholders of the person. So here is how the employer can interact with the employee, the health plan can interact with the member, the doctor can interact with the patient. So in this example, the person might be getting a message that today's the last day for open enrollment. We might be telling them how much sleep they got last night and that they're in the green. They might be getting a tip from their coach. They might be being reminded of their biometric screening, or they might be receiving a care plan from their physicians. And everybody's timeline is different, just like your Facebook timeline is different. The next thing that we do is that we've realized as we've onboarded millions of people into the platform is that some of our users are at higher risk. And so as we look at all that data that we get, the self-reported data and the claims data and the social determinant of health data, we start to assign people to coaching. But we had a very different vision for coaching. So instead of having coaches and call centers trying to track down employees or members at home, we said we have to make the platform feel like the person, like the app is with the person all the time. So almost if Siri was the coach. And so last year we made 10 million calls to members, helping them manage their weight and their stress and their diabetes. This year our goal is to take 10 million calls down to 1 million calls, but take 10 million encounters up to 100 million encounters by using chatbots and other technologies. So basically the app now is sophisticated enough to constantly be chatting with the person as they go out their day, kind of helping nudge them to give support and make the right decisions. in addition to messaging with a person, as we all know, to change behavior, you have to motivate the person. So think of real age as your baseline, right? That's your body age, not your calendar age. And we needed a way to take that baseline into real time. So we looked at what are the 13 items that most influence your real age. It's your stress, it's your diet, it's your activity. And we said, how could we build a frictionless way that we could gather that data and then be able to help people live in the green? So of those 13 items, if you switch 9 of them into the green, then you earn a green day. And the way that you earn a green day is we try to make this as frictionless as possible. So we count steps by your accelerometer. We turn the app on at night and we look for light and sound for sleep. Sorry, excuse me. And then we look at the fractal pattern in your voice to determine your stress. So the idea is every day, like a Bitcoin, this is our currency that we reward healthy behavior. And if you're able to turn these items into the green and get a green day, then a certain number of green days reduces your real age, gives an opportunity for a health plan to reduce your copay or your premium, as well as gives a currency to your employer to provide a reward. This is kind of what the green day looks like. But what's so great about the smartphone is how frictionless this can be. So track your stress by your voice, track your sleep by turning the phone on at night and looking for light and sound, track your activity by just looking at the accelerometer on the phone. The other kind of key component of disrupting healthcare is all around data management. I've mentioned data a few times, but data lives everywhere, and it's a long time often to get the data. So we've been trying to improve that. So within our data management strategy, in one location, you get your medical card, your pharmacy card, you get your procedures, your conditions, your immunizations, your medications. You get your biometric data, and you get your medical records. And what's beautiful about the way this is architected is, as I mentioned before, all the data talks to each other. So we're able to look for gaps in care and then be able to inform your timeline. So as we message, as we motivate, and as we manage, we also have to measure. And one of our big goals at Sharecare has been, how do we make the data real time? So at the same time that our user is receiving this data, and we're extending the platform with the user's permissions to the various stakeholders, how do we have the business intelligence to be able to give the health plans, to give the employers, to give the doctors the information about the user so that it can best inform their decisions on how to interact with that user and motivate that user and help guide them to the best care? And so there's a lot of analytics and business intelligence that goes with data management, but kind of the big idea is being able to see the information real time. So if you've got the data and you've got the partners and you've got the platform, how do you start to drive awareness, activation, and engagement? And so today, I've been talking a lot about individual transformation, right? How can I download Sharecare, get my real age, and start to take control of my health? But we have a kind of a broader vision, working with HMSA for Hawaii and other parts of the country, and we call this kind of our blueprint for change. And the way our blueprint for change works is working with government and working with our partners. We come in and say, how do we start with civic pride? Let's get everybody to know their real age, make them self-aware of their medical history and their lifestyle. And then let's get them onto the platform, and let's bring all these stakeholders to their fingertips and really start to empower them. And as people start to earn green days, that shows a sign of readiness. And when we see readiness in a particular community, we have a platform that we own called the Blue Zones. And the Blue Zones is being implemented in Hawaii today in about 8 communities. And what we do is we then start to invest in people, places, and policy. So in people, we want people to join workshops and walk together. We want restaurants to offer healthy options. We want to put in more sidewalks to walk to school. But as you see individual transformation, that's a heat map for readiness. You invest in the community. When you invest in the community and you're able to show people the right things to do, you get improved state rankings, and with improved state rankings, you get economic impact. So Hawaii, for Sharecare, is a very important market. And it was the first market that we brought the Sharecare platform to. So we went out and we spent $500 million making 11 acquisitions, putting this strategy all into place. And we partnered with HMSA to be our innovation partner. and bring this platform here first. We now have 40 million commitments throughout the rest of the U.S., and I'll show you how Hawaii leading that effort has inspired other states to participate. So you kind of see how you bring the living room to the exam room to the workplace together. So, how do you take a Dr. Oz and a Sanjay Gupta and Oprah to drive awareness? So we brought Dr. Oz over in February and we did some community events. We brought Dr. Sanjay Gupta over to Hawaii in May, and that was all about doctor events, like how could we start to talk to doctors about what consumer-driven healthcare was going to mean. And then how do we get people to download an app? So in June, we had an event in Maui where 6,700 people who downloaded the Sharecare app got to come hear Oprah speak for an hour and a half at the Maui Cultural Center. And so it's kind of, using all these different tools to be able to not only have the technology to empower the person, but be able to drive awareness so that we can motivate people to take control of their health. What's been such an honor, launching Sharecare in Hawaii is being able to take that well-being index and show how Hawaii could be a model for the rest of the U.S. and then getting others to emulate it. So we made a big $250 million announcement on Monday in San Francisco at the JP Morgan conference, where Care First, which is the largest health plan in the Mid-Atlantic region, joined Sharecare as well. So very familiar with what HMSA is doing in Hawaii, and said, how do we now bring this same strategy to Maryland and to the 3 million people that we cover? And what's interesting about this is in Maryland, we employ 250 nurses on behalf of Care First, and we work in a patient-centered medical home model where those nurses work with primary care doctors to take care of the members that are highest at risk. And so we're making huge investments on how those nurses, primary care doctors, and at-risk members manage their chronic conditions through Sharecare. And then that technology comes back royalty-free to Hawaii. So with what HMSA has done for us, kind of paving the way, now all the investments that Sharecare is making all come back to Hawaii royalty-free. And so we're doing some really exciting things, kind of across the country, and Hawaii has been an inspiration for many of our big employers, government, and health plans. So another example I thought I would show you, and we're thinking about how we could potentially do this in Hawaii. But again, being inspired by HMSA, we went and we met with the governor of Georgia, and we said, look where Hawaii ranks in their well-being index, and look where Georgia ranks, and look where Atlanta ranks, which is ranked 83rd. And wouldn't it be great if we could deploy a similar tactic using Hawaii as a model and change the health of Georgia? The governor got inspired, and he enrolled 640,000 of his employees into Sharecare. So every teacher, every state police officer. And we announced this partnership at the Chamber of Commerce. And in Atlanta, there's a lot of big Fortune 500 companies like Home Depot and UPS and Delta and others. And then we went and we partnered with the Atlanta Hawks, which is our NBA team. And for the first time this year, the NBA put logos on jerseys. So Disney did the Orlando Magic, and GE did the Boston Celtics. But we said, we don't want to be an advertiser. We want to create a movement with you, a movement similar to what's happening in Hawaii. So you can see the different ways that we're taking what we're doing to Hawaii, bringing it to other places, and then taking the capital investments in those other places and then bringing it back to Hawaii. So it creates a really great opportunity for innovation. I'm going to end on a couple other points. One is, as we're activating consumers and health plan members and employees, we very much believe that the key to this whole thing is connecting those people back to their provider. Kind of that last mile of, what's the role that the health system and the doctor plays in this. With HCA, HCA is a $60 billion health system. And is an investor in Sharecare, is on the board of Sharecare. We have an innovation lab with them. As I mentioned earlier, we have 50 full-time engineers that are just building products. And we very much have a vision of what connected care is going to look like. So how are the people of Hawaii going to connect to their provider? So on the far left, it starts with what's the business card of the future going to look like for providers. We have built over 2,000 profiles on Sharecare of doctors in Hawaii, where members can go, or patients, and follow their doctor like they could on Twitter or Facebook and get information, take the real age test. We're we're generating thousands of videos that are local doctors. So, last year we sent out 1.4 billion emails to patients on behalf of doctors. We made 9,000 videos last year of doctors with HCA alone. We've now brought that production team to Hawaii to do the same here. We're very much focused on a find a doctor feature of how do you build a match.com that helps the right person get to the right doctor. So forget the second opinion, how do you get it right the first time? And we've invested tens of millions of dollars into virtual reality, so we're big believers in visual health. So if a picture could say 1,000 words, what could virtual reality and augmented reality do? And how do you start to create a consumer-generated electronic medical record, one that's built for education, not just for billing? So we're making big investments on, as you do all this work, how do you connect the consumer, member, employee back to their provider? And then we think back to data, it's all about connectivity. So we're launching kind of our version of an open table for doctor's appointments. And so you can't do all this work of finding people all over the internet and then ask them to call the doctor's office to make an appointment. So you have to have the connectivity tools with that. And then we're co-branding a lot of our marketing with local hospitals. So right now we have 89 hospitals in 22 states where we've launched a big $5 million marketing campaign so that when Sharecare gets introduced to the consumer, it's getting introduced by their local hospital. So again, just the importance of making sure that the provider and the hospital are at the epicenter of this strategy. And we think this is a global opportunity. So we're launching Sharecare right now in Brazil, France, and Australia. What we find is the same strategy. It's data management plus engagement plus awareness is what people are looking for globally. And this was a slide I used at the JP Morgan conference. I had my Georgia Bulldogs event card in there, and there was a quarterback from Hawaii that kind of broke all our hearts in Atlanta, Georgia the other day. But congratulations, that was an amazing performance. And then lastly, it takes scale. To change healthcare, this isn't about a pilot. This isn't about an app. This is about, how do you get employers, how do you get health plans, how do you get health systems, how do you get people to come together in one place and make healthcare better. And as I said as I started the presentation, it's happened in transportation, it's happened in hospitality, it's going to happen in education, and I believe Hawaii could be a model for it happening in healthcare that we could take to the rest of the world. So thank you very much. Appreciate your time.
All right. Thank you, Jeff, very much. Appreciate it.
Thank you.
You and I can just sit down over here. We'll take a few questions right here.
Okay.
Yeah.
Okay, great.
We've got a few minutes left here. Let's see if I can not break this. So let me sort of reflect, I think, what I have, maybe not, let me speak only for myself. I both think that at some point in the future, this is going to be the reality and the present. And at many points in the past, particularly last sort of 20 years, period of time you've been very active in the technology side, there have been a lot of technology folks promise nirvana to healthcare folks, and has not always worked out according to the sales pitch. So how do you balance both, I think, latent acceptance that this is where this kind of thing is where the world is going, with this sort of more active pessimism or cynicism of having kind of been sold a bill of goods in many cases over the last 20 years?
Well, I think the smartphone, gives us the opportunity to potentially have the greatest healing device we've ever seen. It's with us all the time. It's packed with technology. We've got accelerometers and social graphs in your calendar. We didn't have that in the past, number one, so I think the smartphone. Two is I think there's been so much failure that people realize now we have to collaborate. That the hospital portals, the employer benefits, the health plan apps just don't get the engagement. And it's for various reasons. Maybe the user's not sure where the data is going, or can the data be used against them. And also, I think we're now living in an on-demand world. I mean, our expectations of people have changed. I mean, I expect that I'm going to be able to walk out of here, click a button, and a car's going to come around the corner and pick me up. I can watch any movie, anytime, anywhere. I think that has all changed. And you're starting to see reimbursement models push this direction too, with high deductible plans and self-insured employers and others.
Do you find, or to what degree do you find that Hawaii is somewhat unique because of the role HMSA plays, because they have already been moving down the pathway of a provider relationship that is based on value? How unique is the application of Sharecare to Hawaii because of the role of HMSA vis-a-vis other states where plans are much less consolidated?
Well, Hawaii is the perfect market because it's already got such positive momentum as reimbursement models, #1 in the well-being index, healthy population, optimistic population. But we globally pretty much see the same thing, right? Is people want to see consumers empowered to take control of their health. They say if people have access to the information and take control, that's how we're going to reduce costs and get the best outcomes. And I think every health plan that we deal with, from Sul America in Brazil to different blues plans in the U.S., they want to have good relationships with their doctors. So I don't really find the conversation any different anywhere that we are. We want to use the phone, empower the people, give them the data, create the right incentives, have good relationships with the provider, help the employers manage the cost, and help the community thrive. And good health is a good way to help the community thrive.
How do you ever get pushback from, or where does the pushback come? And let me sort of make a statement, tell me whether you think that it fits. There are a lot of people employed in healthcare. A lot of people employed in healthcare believe that there needs to be some disruptive force. However, a lot of the people who are employed in healthcare who believe there should be some disruptive force might get disrupted out of their employment. In other words, the money that goes into healthcare, if disrupted significantly through other tools, could create, damage at the individual employee level within the healthcare system. They might lose their job. Their job might change. Do you ever find some sort of resistance to change at the sort of operational level of healthcare?
Well, I think everybody talks about value-based care, but a lot of organizations still live in a fee-for-service world.
Yeah.
And so sometimes I feel like some of these large hospital systems and others are kind of hedging, right? So they talk about value-based care, but they're really about heads and beds, and they're living in that fee-for-service world. And so, it could be the acceleration of these new technologies and these new ways of care could happen faster. But, they're kind of dipping their toe into it, kind of protecting their fee-for-service world while they hedge, to a value-based model in the future.
Mm-hmm.
But again, I think what drives that change is the consumer.
Mm-hmm. Do you, you've been, just saying the words WebMD, that's a brand that's been around a long time in healthcare and technology. Do you have counsel or advice to this room of folks in the healthcare space, people who are going to watch this online? What counsel would you give them from somebody who has straddled both healthcare and technology about where technology will disrupt the healthcare system, and really how should they be navigating their organizations during this pending time of disruption?
I think my advice is to embrace it. I always, kind of put yourself in the shoes of the user. What would you want as a person? If you could, do you want to have 15 apps on your phone to manage your health? What if all your wellness and your illness and your lifestyle was one place and you controlled the data and you had the permissions and it was in a user experience that you could understand immediately from the moment that you picked it up? I bet every one of us who have used Uber can remember the first time they used it and they see that little car coming around the map to pick them up. And you're like, wow, is that really coming for me? Mm-hmm. I think data management in healthcare on your smartphone can be that easy. It's going to take a little bit of time, and it's going to take the big players in healthcare like HMSA, that are investing in this innovation to make this change, to make it happen sooner rather than later. But I always say, this stuff sounds like a 2020 vision, but I believe it's a 2018 reality. I was at Google about a year ago, and autonomous cars seems like so. Okay, yeah, I get it. They're sort of here, and I've read about them, and there's Uber's using one of them in Pittsburgh. And then I walked into a parking garage at Google, and they showed me 3 parking lots that were packed with autonomous cars. I mean, as far as you could see. And you start to realize that, when you're showing the stats of like by 2020, I'm not going to want to own a car. My kids may never get a driver's license.
Wow. That might be a good thing, knowing my kids, at least knowing my kid's father. Which is me, I should say. To clarify, let me ask this final question. What help can the Hawaii healthcare community give to the work that you're doing?
Feedback. There's so many new technologies. Is it easy to understand? Is it easy to use? Are the solutions helpful for you? What partners aren't participating that should be participating? Do you buy into a blueprint for change? How do you have civic pride? And with civic pride comes individual transformation. To do individual transformation, do you have the tools that are personalized for you? Do you buy into community transformation? Should we be investing in people, places, and policy? Make it easy to do the healthy thing. And then, as you achieve that, does the state become healthier, more productive? Do we have more purpose? And what's great about digital is you have amazing analytics, right? So you get feedback real time based on usage. But we really hope the concept of Sharecare is everybody sharing care together to improve healthcare, and feedback is key for us.
Jeff Arnold, CEO of Sharecare, thank you very much for coming out and joining us. I appreciate it. Let's give him a round of applause. Thanks, sir.